Welcome to the Hope Podcast. My name is Jonathan James, as your host for this podcast. We are excited to bring you some amazing information about people living with bleeding disorders, navigating chronic illness, and we hope that you enjoy this podcast. Well, welcome to Hope Charities and our event podcast here. We're getting ready for our Prophy Conference coming up in just a little bit. And I actually invited one of my dear friends, Stephen Lee, to join me today to talk a little bit about prophylaxis treatment, but also to talk more about how to talk with your pharmacist. That's something that I think is a big thing. And love to have you here today, Stephen. Thanks so much for joining me in the office.
Thanks for having me, Jonathan. For everyone out there, my name is Stephen Lee. I'm a pharmacist with Factor Care, and I'm also a severe hemophiliac factor IX deficiency. And I'm here today to talk to you about Prophy and also questions for your pharmacist.
Yeah, that's great. Well, let's just dive right in. I want to know a few things. I want to talk a little bit about, some of the things we're talking about with consistent treatment regimen, what to talk to your pharmacist about. But let's maybe just start from the beginning. Tell me a little bit about where you're from and some of your experiences about growing up with hemophilia.
So I'm born and raised in the New Orleans area. Believe it, I'm from a suburb outside New Orleans called St. Bernard Parish, but growing up, my family had restaurants nearby the Hemophilia Center, so I was fortunate enough to have a very close relationship with the Hemophilia Center. That being said, I grew up in the early 80s where we had tainted factor products, known HIV infections, hepatitis, things of that nature, and the factor products weren't scanned really for those products until 1985. Because of that, there's a lot of scares, a lot of things that we don't know because our older generation were basically taken out of the community, so we don't have a lot of data on us. But also, I grew up in a time where we only treated bleeds as needed, and we would use minimal amounts of factor just due to sheer cost of the medications, whether we didn't know what the costs were, but the hospitals did.
Right. Well, let's talk a little bit about that because, when we were growing up, prophylaxis was not something that was commonly recommended. And, you had a lot of challenges with joints and having even surgeries to correct joint damage and things like that, as I did. And so talk a little bit about what was it like growing up with hemophilia, and then, of course, sort of learning how to self-infuse and then kind of getting into the whole preventative therapy mindset.
So growing up with hemophilia, we had our challenges because my parents, I was their first experience with hemophilia. Being immigrants from Vietnam, they didn't understand much. So luckily the Hemophilia Center was able to get my parents in contact with a family that did have hemophiliac children and were able to guide them. But basically, I was the 80s equivalent of a bubble boy, sitting on the sofa, not playing any sports. And really there were joint damage and crippling disabilities were so common in hemophiliacs that they were trying to preserve my joints the best way they knew how. And back then was just really preventative care, and by preventative care, not prophy, but actually preventing me from having fun, which you don't want to feel that you're limited because truly we aren't. Mm-hmm. But you have to understand that there are good decisions and bad decisions that we have to make on a daily basis, and our health is something that we have to consider when we make those decisions. That's right. So growing up, whether my parents were infusing me or early on the Hemophilia Center was able to infuse me after their rounds, that was one of the perks, I guess, that I was able to have just being so close to them. Getting just PRN infusions as needed when I had bleeds, which happened to come about 2 to 3 times a month, maybe 4 on my active months, into learning how to infuse at home, which happened at the age of 10, albeit I didn't infuse myself at home even after I learned because there's a lot that goes into it, including psyching yourself up to actually put a needle in your arm. So true. It's difficult at the beginning, but it's something that once you realize and then you focus and you realize you just have to do it. Yeah. It has to be done. And once you can get over that, you can do it.
That's so true. So let's talk about that a little bit more as far as your experience with learning how to treat on a preventative basis versus treating once you feel that inflammatory bleed happening. I think you were at an advantage, maybe even that I wasn't when a kid, I went to the hospital every week and got infusions in the emergency room for the most part. And, I can remember, it was an hour and a half ride, just to get to the treatment center. So it wasn't fast. And so, I mean, even an hour with a bleed that's once you've identified, hey, this is, and of course as a child, I mean, you just start with, like crying and everything, and then it turns into a big, dramatic thing when you have a lot of pain. And so I was struggling with that as a kid. And of course, another hour and a half on top of that by the time, my parents would just, be able to get me to the emergency room to have the infusion. So you've already got a fully metastasized bleed happening before you even get therapy. So we had joint damage that, we were fortunate to be able to survive those things because we did have some form of treatment. But now with this preventative mindset, I know for me, when I was in college, it was so difficult for me to be able to go from, matter of fact, I think preventative treatment was something that was starting to be promoted when I was in college, maybe. But I mean, I'm an adult with kids on my own before I really started to embrace it, because that mindset was very difficult for me to shift from that to the other. So talk to me a little bit about, for you, going from this like sort of place of I'm just responding to this bleed happening in my body, now I need to go get treatment, to shifting to like, now I got to psych myself up and stick myself with a needle, and I'm going to do it on a treatment regimen plan that is pre-planned. How did that happen for you?
So for me, this treatment, the Prophy treatment started in college for me. So I was roughly about 18 or 19 years old. And it really stemmed from damage caused in my high school years, because I was more active in my high school years. My bleeds were more frequent, and my small town doctors basically misdiagnosed my issues with tennis elbow instead of frequent bleeds, and with him being a smaller town doctor, not having the understanding that the hematology team has, they don't realize the damage that happens to your joints when you're having an active bleed. So we're going from PRN treatments maybe 2 to 3 times a month, and having that pain episode, which, like you said, you were an hour and a half at least. But to be honest with you, many times I didn't get treatments till rounds were done. So I might have to treat a bleed the night before and not be treated for the better part of a day after, just having to wait until someone's available to help me with that. And the joint damage was done. So once I was assessed by the hemophilia team at the treatment center, and they suggested surgery, that's really when Prophy came into fruition, and saying that, hey, you know what, you would be a good candidate for this to help prevent your joint from degrading and help prevent these bleeds from happening. And ultimately, if you can prevent yourself from going through those pain episodes and those bleeds, that alone makes Prophy worthwhile. Decreasing the joint damage that's associated with those bleeds, that just makes it even. There's no reason why we shouldn't be on Prophy at that point.
Right. Let me go back. So you talked about this was going on in your mind while you're going through college. I mean, tell me about that. I mean, it takes a lot of determination as a person living with a bleeding disorder to get through college. I mean, it just does. It's just the brass tacks. It's hard to push through. I think in today's environment, it's a little bit different just because people do have access to online school and other options. But, it's very difficult to push through when you're having bleeds regularly and everything. And then here in your journey on top of that, you're also shifting from dealing with bleeds, learning how to self-infuse, and you're also in a place where you're doing preventative, trying to shift into preventative therapy at the same time. You must have had an incredible support system to be able to get you through college, because you not only went through a regular, bachelor's program, but you also went really a pharmacist is a form of a doctorate, right?
Yes. So I do have a doctorate degree in pharmacy. It's a 6-year expedited program that's available through a local university. But ultimately, when you're in college, this is really your first time being an adult. So when you're in high school, middle school, elementary school, your parents kind of controlled everything, and they made the decisions for you many times. Like, hey, you're hurting, let's infuse now. You're doing this, let's infuse now. And when you're in college, not saying that you're off on your own, but the dynamic of your life changes. And in reality, knowing what all that pain I went through in my high school years, knowing that I have a surgery coming up, and what damage was done, and knowing that's not reversible, understanding that, hey, now look at all these limitations I have going forward. It really made it that much more. It really emphasized the fact that I need to be more compliant.
Right.
I need to definitely take more control of my life. And it's so easy to regress when you're in college and you just want to I want to be like the other kids. I want to, hit the quad on a weekend and just hang out, whatever it may be. But we can do everything the other college students do. We just take a 20-minute break to self-infuse beforehand.
Right. Right. So when you were going through college and you were going through all these different things, you also had some joint damage that required some surgical correction, which was, good for some relief, if you will, but also it was difficult and painful and challenging. Tell me a little bit about how that went for you in having those surgeries.
Well, with the misdiagnosis in high school of my joint bleeds being tennis elbow, the amount of damage done over the course of those 4 years or 5 years that I was very active in high school and working out and doing exercises and being active playing sports, it took a toll. Ultimately, what it led to was I was a elbow replacement candidate, but at the time the technology wasn't there for a lifelong fix, just due to the fact that the elbow replacements weren't made well enough that it would last someone that's in their teens or early 20s the rest of their life. So the plan of action that we took with the doctor was, let's be as aggressive as we can with a radial head resection and a synovectomy, and that would buy me time into the future where better technology is available and better products are available. Right. And with our disease state, it's an ever-growing industry.
Evolving, yeah.
Things are gonna change, and it's gonna be for the better.
Yeah, I mean, I guess the big question that I get asked a lot, and you probably do too, is, are you glad you did it?
So yes, I'm glad, because prior to the surgery, I was getting bleeds at least once a week in my elbows, to the point where that limb would be useless. The pain associated with, honestly, if I didn't have a strong family help and mental status, I mean, some people may contemplate hurting themselves. And it's going to be one of those things where understanding the disease state and understanding that, well, the most of the inflammation happens in synovium. So if we were able to shave that, you can reduce that inflammation and pain greatly. And understanding that the grinding is happening at the radial head. So if you resect that, that's not going to touch anymore. And understanding, having a team that understands your disease state and working with them to find the best route to treat it was really ultimately what led to the decisions. Like, I trusted the HTC to make the decision. I trusted the orthopedist that I went to that was well known in the industry. And you put a lot of trust in your healthcare team, and we decided that was best for me. And I don't regret it one bit. I did one surgery because I had to, just because my right arm, to gain use of it, I needed to. And I did my left arm really, even though I didn't use it as often, I did it because I made decisions like, I want to start a family. I want to get married and start a family one day, and I don't want to do that if I can't do simple things as pick up my child and be able to take care of them. So I did it for them, really.
That's so good. Well, I guess, talking about prophylaxis, it's appropriate to ask the question. I think a lot of our listeners would probably want to know, if you had the opportunity to have prophylaxis treatment as a young person, do you think it would have prevented your need for having those surgeries?
Absolutely. I think if we had Prophy on board as an infant or child, then the outcomes would be so much better for people across the board for hemophiliacs.
Absolutely.
Because instead of having to wait time to bleed, theoretically we would be normal. Mm-hmm. So our body would have what it needs to fight whatever it needs. It would be able to clot when it needs to, and when we have those bleeds, you don't realize that it's just not blood pooling in joints. It's inflammatory mediators, and those things are causing damage. They're attacking cells around it. So if you have prophy, and that you rest it, and you listen to your body and understand that, hey, your body's trying to tell you that lay off, maybe don't do that again. the likelihood of having a hemophiliac with crippling disabilities are greatly reduced, greatly, if not totally reduced.
Yeah, and I think that, a lot of people, I mean, you mentioned you were interested in, getting married and raising a family, and all of those things were things you were going through your head. And I think a lot of people that's a point of demarcation for folks. Sometimes you go, I know I felt like at one time that I couldn't get married because, just because I had so much pain and so much damage and so many surgeries that would be needed. And I'm thinking in my head, as a young, or I should say an older teenager even, that I was, at a place where I thought, well, gosh, this is just my life forever. And so it was very difficult. It's one of the reasons why we put a lot of emphasis on mental health, in the outreach that we do, because we see that was a huge missing component. I know for me it's something that pretty much everybody struggles with. One of the things that I think those moments help for a lot of people that go through any kind of hardship, if you get through it on the other side, though, strong emotionally and mentally, if you can get through those things. And so I think that it's important for people to recognize and realize that the preventative treatment is really what prohibits you from having to experience some of what you and I experienced. Because the surgeries are disruptive. They oftentimes, I know for us, it came in raising age, or it came in times when you wanted to get married and things like that. So it's disruptive to life. It's also very difficult to get through school, or it's very difficult to complete maybe a job or a career change if you needed to. And so, we want to encourage people. I think about this all the time, is that we want to encourage people to stay committed to your prophylaxis regimen, because, the alternative is hemophilia is a joint debilitating disease. Mm-hmm. Ultimately, the ramifications of not treating have, severe consequences that can be very debilitating, and it's vital that you stay consistent on your treatment plan, which really brings us up to, a lot of other topics like insurance, for instance, and maintaining access to your medication is very critical. That's another point that can be a barrier for people getting. Sometimes people can't choose their own pharmacy or their own pharmacist. Sometimes they can't even choose their own physician. We talk to patients every day that are in a place where their insurance isn't covered. The treatment center in their area is not covered by their insurance, so they can't go to their treatment center. They have to go to a different doctor. And so those are barriers that are very important. But let's just say, keeping all things equal, as a person living with a bleeding disorder, what do you think is the value of having a good relationship with your pharmacist? Because whether you know them or you don't know them, I think it's good to be communicating with your pharmacist, right? You're dependent upon this regimen. You're dependent upon this connection.
Absolutely. As a pharmacist, we can only do so much with the information we're given. So the more information that we have, the better we can do our job. But also, when you're dealing with specialty medications, you're usually dealing with smaller pharmacies that are dealing with smaller groups of people. And by doing so, you should really reach out to them and build a relationship with that team, because you're trusting them with a lot, and they can do their job better if they're filled in on all the things going on in your life at the time, whether it's other medications that you take, or your disease state itself, any complications you may have, any target joints. There's so many different things that you can discuss with your pharmacist and build that relationship. And once you have that relationship built, and basically you'll be on a first name basis eventually, you have someone that's more accessible than maybe your doctors that see hundreds of patients and may not have the time to. Your calls may be filtered through different avenues before it actually reaches them.
Okay, I get it, and I'm going to play devil's advocate for a minute, because I really have a hard time with this myself sometimes. I get a call from my pharmacy or from my pharmacist, and they ask me this list of questions. What's your weight? What is your da-da-da-da-da-da? And I mean, as a person, and I mean, I know you can, you know the value of it, so because you're on the other side of the curtain, if you will. But for me, I get these questions, and I'm just like, oh my gosh, are you serious? Do I have to answer the same questions over again? But really, it could be a huge, really point of prevention if you take that information or those questions and you answer them seriously, because really you're the first line of defense as a pharmacist. Mm-hmm. Almost sometimes even more than the physician. You might have a great working relationship with your physician, but you're going to be talking to your pharmacist sometimes more than you will your treatment center doctors, right?
Absolutely.
And so the doctor's the one that's prescribing, but you're ultimately the one that's sort of helping in that management component. So tell me about, like, what would you say to somebody who's frustrated by, I'm asked those questions every month, and I kind of just want to roll my eyes and just like blow over it. But those things are actually could be potentially very meaningful to making your care even better, right?
So yes, as a patient and as a clinician, I too get aggravated with those calls. Like, hey, it's my weight hasn't changed, my medications haven't changed. I get it, but as a clinician, we gather that information partly because we have to make the best clinical judgment when we filling your medications as possible, but also we can also maybe catch things that other healthcare professionals didn't catch in the process. But once you have that relationship, that conversation can be cut greatly, because it's going to be, hey, John, well, everything's the same. Yeah, for the most part, everything's the same. Okay, well, in that case, well, let's get to the important things. Well, did you have any bleeds? You did? Okay, well, let's not discuss it. Or you did? It's the same. They might know automatically. They might know, like, oh, it's your knee again, isn't it? Or is it your elbow? They get to know you over a period of time, and that's so important. And it helps expedite it, and it makes the phone call less laborsome.
Yeah, I think that if you can get on the phone with your pharmacist and have that personal relationship, this is somebody that really does know your situation and should know your situation, and it's okay. Tell me about what are the things that are maybe appropriate for someone to ask their pharmacist. Like, what questions should I be asking my pharmacist when I'm thinking about my relationship with this?
So the standard questions are usually, do these medications interfere with one another? Does the medications that they wrote for me interfere with my disease state? Both of which we have to have an up-to-date history to know whether it does or does not. And then you can go on to other things like, well, what's the storage of these products that you're sending me? Can I leave it at room temperature? Does it have to be refrigerated? What if I'm going to travel? Is it okay to be in my suitcase for the flight? Do I have to pack a cool pack? Well, if I have to, well, with the airline regulations, what do they allow? And many times, it won't be the first time your pharmacist is encountering those questions, and they may have a lot of information to give you and understand that, hey, especially one that lives through it. I've traveled plenty of times with my factor, but it's for the most part, it's, believe it or not, any question that you may ask, more than likely you've heard it before. There's very rarely do we hear something new, and it doesn't necessarily have to be with just the medication you're receiving that day. They're a wealth of knowledge. Use them as such. If you have something going on, hey, I have this suspicious rash, or I have this discolored body part, or I have some redness from an insect bite that's not stopping. Well, you know what? Ask them those questions, because one, it might save you a trip to the doctor's office or urgent care, which saves you money. But two, it may escalate the situation and you get care on time to make sure that you were treated appropriately and you didn't dwell on something that could have been deadly or fatal. Deadly.
It's true.
Yeah.
Yeah. Also, I mean, I think that just sometimes there's other barriers. Like, we get calls from pharmacists sometimes about just copayment assistance programs and things that you might not think of, that you think maybe this isn't just entirely medical, but it is a barrier to me getting access to my medications. And a lot of times your pharmacist is the first person who can direct you to some other resources out there that might be able to help you with that.
So absolutely. One of the biggest hurdles in getting care, especially on medications that we take, is the sheer cost of it. Yeah. And someone that specializes in these medications should know that there's plenty of help available, and being able to forward you in the right directions, whether they can give you the website directly to sign up. Many, it's just as easy as giving them your birth date, address, and phone number. There's plenty of help to get your medications. People with hemophilia, many of which tend to be on Medicaid, and in that situation, your medicine should be covered regardless. Mm-hmm. But understanding that what else comes with your medications, knowing that, supply should come with your medications, and knowing what you can and cannot ask for.
Yeah, like I wonder sometimes, if somebody ever asks you, like, if they're really particular about a special kind of Band-Aid or a special kind of needle. I mean, does that bother you when a patient asks you, like, hey, can I get this kind of needle that I like?
No, not at all, because as someone that lives with the disease state, I really feel that there are products that people that don't live with the disease state, they don't understand. And whether it's the thickness of your gauze to absorb the blood, because sometimes they'll mail you some that's a 2x2 and it's a better use as a cheesecloth than it is a gauze, or like needle size.
Yeah.
Because you never want to use the biggest needle available. You want to use the one that's going to be the most comfortable, easiest to slide through your skin. And needle shape, contour, everything, it matters.
Yeah.
Because how sharp those bezels are, the brand that you use, it can make a difference in how comfortable that injection will be. There's so many different things. I find myself a little particular about the products. I have a particularly favorite tourniquet that I use because some don't work as well as others, or some are more comfortable than others, some are easier to use. It's okay if they are able to work around your preferences, albeit sometimes they are limited what the wholesaler has.
Yeah.
But ultimately, it doesn't hurt to ask.
So you would encourage anybody who's listening to say, "Hey, speak up, ask for what you like."
Absolutely. I know I've voiced my opinion many times, and I know that I've asked for syringes because I use multiple vials, so I prefer it being all in one syringe, so I consolidate down one syringe. Well, some businesses that I've used in the past, they didn't take into consideration the final volume, what you're using, to the syringe size. So it's like, well, how am I going to fit 7 vials of medicine in a 15 or 20 cc syringe? You should have shipped me a 30 or whatnot. But being able to understand what you're going through and understand that what's involved with your medications and the process of giving it to yourself really helps with taking care of your needs.
Yeah, that's so good. Well, if I'm not mistaken, you're one of the few, for sure, in the whole country that is a hemophilia patient, and you're also a pharmacist. We're starting to see quite a few physicians now. We've got a number of guys out there that have become physicians, and so that's kind of neat. But if I'm understanding correctly, I think you're one of just maybe the only one, but you're for sure the only one that I know very closely. But that is both a pharmacist and a patient. So that's really neat. And of course, now with your new role with Factor Care, tell me a little bit about what you're most excited about that role, because now you get to actually fill scripts for people with bleeding disorders, and that's pretty exciting as well.
Well, living with the disease state, understanding of how I've ordered my medicines in the past, things that I liked from different companies, things I didn't like from other companies. I took all the information I gathered over the years of what I liked and decided I want to help people within my own community, and I want to help them the way I would want to be helped. Mm-hmm. I want to streamline things. I want to make sure that if you need it, we'll find a way to get it to you. We're not going to go, oh, well, it's Friday and we can't mail on Friday because it's we don't ship for Saturday delivery or Sunday delivery. Well, if it's going to make me take a drive or have one of our staff take a drive and deliver it to you, we'll do that if you need it. If that's something that you need, it's really going to be a concierge sort of business where we're going to take care of your needs any way we reasonably can. And you have members on staff that understand it's what you're going through, so understands that there's a reason why you're asking, because you need it and we understand it.
That's so great. Well, I'm excited about all that you're doing, and really appreciate you having this conversation today. I guess, with specifically Prophy Conference and having the conversation about the importance of staying consistent and staying, faithful in your regimen, maintaining access, all the things that are really surrounded around this idea of preventative treatment. I'll just ask you personally, aside from all the other, things that we've talked about, how is your life better when you stick to your treatment regimen?
So that means that it's better because I don't have the pain crises that I used to have. So when it would knock you down for days at a time, because you're talking about when the bleed starts, it starts with an uncomfortable feeling in your joint, but by that night, you're going to be in some good pain, and once you get some factor in, it may linger for a couple of days. I no longer have the pain crises that I used to have, which allowed me not to be on any kind of prescription medications for pain. I have been on them in the past. I no longer use any products because the Prophy really keeps the bleeds away, and even when it doesn't, I usually have some factor on board, meaning that I'm covered. But if I need to do an additional dose, it gets my factors level so high that none of the pain and the inflammation will progress to that point where I'm in serious need of an urgent care or a doctor giving me a prescription for something to help me tolerate the pain.
Yeah, that's so good. Which that affects a lot of things. I mean, it affects your focus. It affects your ability to be present for your family. It affects your ability to be successful in your job. All of those things. So it spills over into kind of every area of life, right?
Absolutely, absolutely. When you're going through those bleeds, depending on what you do for a living, if you have a bleed in the knee and you're standing all day, or your ankle for that matter, it's going to be difficult to do your job. And sometimes sitting is not an option, especially when I was a retail pharmacist for so long. I can't imagine standing 14 hours a day working at your local corner retail store on my feet the entire time and having an ankle bleed that day. I wouldn't know how I managed that. But luckily, with prophylaxis, most of the time I was able to avoid that. And when I couldn't, usually the bleed would slowly progress as the day went on. But I kept appropriate things in core, braces, supports, things of that nature that helped me manage the day.
Yeah. So, moment of truth, honesty. Do you ever get off of your own Prophy schedule? Do you kind of sometimes find yourself forgetting sometimes, or you get busy and skip?
So no, it's
You're a
very
better person
easy.
than I am.
It's very easy to forget to give yourself a dose.
Yeah.
So, but luckily I use different techniques. Like for instance, I set a day, and I know if the day of the month ends in a 7, I'm giving myself a shot. So on the 7th, 17th, and 27th, I'm getting a shot.
Wow.
So, and sometimes I will be off by a day just because I forgot. It's like, oh, it's the 27th and it's 11 o'clock at night. I'll just do it tomorrow.
Right.
So usually if I forget I'm only going to be late a day or so. Luckily, I'm on a long acting factor and I have that flexibility that I will still have some coverage. I'm fortunate.
The fact that you're able to stay consistent all the time, that's great. Because I know for me, I get off track a little bit and from time to time, and I just forget, or life gets busy. And I have to play catch up sometimes, and it's really frustrating because I feel it in my body. You know, I do. I feel it slows me down. I start hurting, or I start having a bleed, maybe even, and I'm like, oh, dang it, because I forgot. And you wouldn't think, after all these years of doing it, you'd do that, but sometimes it still happens, and so, but that's encouraging. I know one of the things that you've said to me before is, that you kind of see yourself as a big brother to people living with hemophilia, and I feel the same. It's like, man, we've made the mistakes. We've gone down the path. We've had the journey of some difficult days and some painful things. And so, I want to encourage you, if you're listening to this, or if maybe you're just listening, you're thinking for your kids, even for them to hear this would be a good conversation for them to hear. Man, let us know, because we make comments in the comment section, or, reach out to us at Hope, and we'd be happy to talk to you more about, how to stay committed, how to stay consistent, especially because all of us have times where we get weary, we get tired, but I know you're excited about being able to mentor people and being able to help show them the way. You told me a story one time of your older brother. He made all the mistakes, so you didn't have to, and you got to learn from his stuff. So I know that's a big part of your heart.
So yeah, anyone that had an older sibling, they probably learned a lot from their older sibling, and realized that your resources available to you are kind of the same thing. It's a wealth of knowledge that they've been there before you have, and you don't have to make the same mistakes because you have someone to tell you, hey, this is the better route, this is the better idea. Don't make the same mistake I did. And it only allows you to grow even quicker and better and bigger. So it's being able to help other people not make the same mistakes I did, or live a better, more fulfilling life than I did, and be healthier. It's a dream of mine. It's really, I want to do this to make sure that other people have an opportunity that maybe they wouldn't have had if they were growing up in the same time frame I was growing up in.
That's so good. Well, Stephen, thank you so much for everything that you've talked to us about today, and just been so encouraging to that we can make it. I know that sometimes when things get difficult and long, it's hard to say, man, nobody, you start to feel alone. You feel like you're the only one that's ever walked this path, or you're the only one that's ever experienced this kind of pain, or you're the only one that's ever had this surgery. You're the only one that's had the kind of deal with giving yourself infusions on a regular basis. And man, just talking to you today, I know I feel inspired, and I know I'm sure others do as well. But thank you for joining us on the Hope Podcast, and it's great to see you. And thanks for for being a part of Prophy Conference, because I know it's a big deal to be able to kind of just give as much positive feedback as we can and inspire others to be able to keep going.
No, well, thank you for having me. And just remember, just like one of the hope slogans, you're not alone.
That's right. Well, great. We'll see you next time.
I'll see you. Thank you, Jonathan.
My name is Rick, and I have severe hemophilia B, and I've been using Idelvion since 2017. I am considered a severe hemophiliac. With Idelvion, I'm confident in my bleed protection. That way, I can do things that really matter to me, like spending time with my wife outside, playing my guitar, doing my Tai Chi. I've been involved in martial arts my entire life. I originally started way back in 1972. I studied Taekwondo for a number of years and eventually became the Colorado State heavyweight champion. But those years did damage to my body, and the pain it caused me in the long run led me to seek out Tai Chi. I have discovered that Tai Chi is the absolute perfect martial art. You only do what your body allows you to do. It allows you to develop strength, flexibility, and peace of mind. Through Tai Chi, I have come to realize that I have hemophilia, but it's not who I am. When I was treating prophylactically, I would infuse sometimes 2 to 3 times a week. I may get maybe 3 or 4 breakthrough bleeds a year. To me, as a hemophiliac, that's not satisfactory. I felt a product should work for me till my next dose. I haven't had a breakthrough bleed since I've been on Idelvion, and that's been almost 4 years. My factor levels have consistently been 21%. The product works for me. Hemophilia, by nature, comes with a lot of stress. I've learned to control stress in myself, and I love the fact that I'm able to experience my life.
Important safety information. Idelvion, coagulation factor 9 recombinant, albumin fusion protein, RFIXFP, is used to control and prevent bleeding episodes in people with hemophilia B. Your doctor might also give you Idelvion before surgical procedures. Used regularly as prophylaxis, Idelvion can reduce the number of bleeding episodes. Idelvion is administered by intravenous injection into the bloodstream and can be self-administered or administered by a caregiver. Do not inject Idelvion without training and approval from your healthcare provider or hemophilia treatment center. Tell your healthcare provider of any medical condition you might have, including allergies and pregnancy, as well as all medications you are taking. Do not use Idelvion if you know you are allergic to any of its ingredients, including hamster proteins. Tell your doctor if you previously had an allergic reaction to any Factor 9 product. Stop treatment and immediately contact your healthcare provider if you see signs of an allergic reaction, including a rash or hives, itching, tightness of chest or throat, difficulty breathing, lightheadedness, dizziness, nausea, or a decrease in blood pressure. Your body can make antibodies, called inhibitors, against Factor 9, which could stop Idelvion from working properly. You might need to be tested for inhibitors from time to time. Idelvion might also increase the risk of abnormal blood clots in your body, especially if you have risk factors. Call your healthcare provider if you have chest pain, difficulty breathing, or leg tenderness or swelling. In clinical trials for Idelvion, headache was the only side effect occurring in more than 1% of patients, 1.8%, but is not the only side effect possible. Tell your healthcare provider about any side effect that bothers you or does not go away, or if bleeding is not controlled with Idelvion. Please see full prescribing information for Idelvion, including patient product information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958.
Hemophilia A is a rare genetic condition that makes it hard to stop bleeding. And it doesn't just affect the body, it affects everything. But these days, science and innovation can help people with hemophilia better manage their disease, which leads to a different set of challenges altogether. When you're used to what you can't do, it can be hard to realize what you can. For example, I can do magic. But what makes me, a magician and comedian, qualified to talk about the struggles of hemophilia? Nothing really, but this is why I'm here. My first solo gig as a magician was for the Hemophilia Association of St. Louis, which means a bunch of people in the hemophilia community gave 12-year-old me a shot at greatness. And now, I'm here to pay it forward. This isn't a show about hemophilia. It's a show about human potential, taking that next step, overcoming barriers, letting go of excuses. This is Challenge Accepted.
Hi, my name is Anna Moss. I am a Santa Fe Genzyme Core Manager. I am living in New Orleans, Louisiana. A core is a Community Relations and Education Manager. I am here to help serve, to help guide, empower, educate you, your loved ones living with hemophilia. I am here to assist you. I believe that word would be resilient. I know that people living with hemophilia, people diagnosed with hemophilia, have overcome obstacles, have had to and have to adapt to change every day, multiple times a day even. And I believe that you overcome that and you are living the best and most empowered life that you can.